Hello and welcome to today's webinar by Bausch. My name is Mina Nazimi. I'm a dentist from Cologne and I am very happy to be presenting today's subject to you. Okay. I hope that you can hear me and also see my screen. I'm going to open the chat as well. In case you have any technical difficulties, feel free to let me know. Other than that, I'm going to get started. Okay. So the subject we will be talking about today is OccluSense, a product by the company Bausch, and Bausch was established back in 1953. Probably most of you have already used the occlusion papers and foils that we can't go without in our daily dental practice today. And as a family-based business, I actually have a little bit of flickering in my screen, so I'm going to just for the presentation turn my video off. Okay. All right, I hope this is better. In this short video, you can see the production site. So Bausch is based in Germany, Cologne, and the production site a couple of hours away by the Fühling am See. Here you can see how the products are being produced and packaged and then shipped out. And what we will be talking about today is OccluSense. OccluSense is occlusion in a digitalized manner. And in order to understand what is happening when we use OccluSense, I'd like to ask quite a basic question. And I want you to think about how you check the static and the dynamic occlusion on your patients in your dental practice. So the current standard has been unchanged for quite some time now. We have the normal articulating paper, foils, different colors, different forms, and those can be used to check occlusion in all three dimensions. So as you can see in this illustration here, you can use different colors such as red for static occlusion, black for protrusional movements, and green and blue for laterotrusional movements. For anyone who's done this on their patients before, we know that this is a very time-consuming matter, especially if this process has to be repeated a few times. And that's exactly where OccluSense comes into play. OccluSense is digital occlusion, and it consists of this handheld, an electronic pressure sensor, which you then insert into the handheld. This can only be inserted the correct way around due to asymmetric pins and holes in the handheld and in the sensor. So once you have inserted this correctly, you are able to then close the sensor. It will make a little clicking noise, and then you're able to get started. So you insert the sensor into your patient's mouth, get them to conduct any movement that you want to have recorded, and the data will then be wirelessly transferred onto an iPad where the illustration is then shown. The markings are left on your patient's teeth simultaneously, so you also know what you are doing at the same time, intraorally and also on the iPad. And you can obviously do this for static occlusion as well as dynamic occlusion movements. So as we have seen, the OccluSense system consists of a handheld with two buttons of an iPad, where you should have installed the OccluSense iPad app on the Apple Store. And OccluSense sensors, which are available in two different sizes. So we have X and XL currently, and these differ in width rather than length, whereby they are able to detect 256 different pressure levels while still remaining 60 microns thin, and also contain a very thin and flexible material, so you are able to insert the sensor into differently sized mouth openings. And one very extremely important factor to me is the red color coating, which means that any movement that you conduct in your patient's mouth will automatically be transferred onto the patient's teeth. How does OccluSense work? In order to get started, you need to do an initial setup only once, whereby you have to ensure that your iPad is connected to a wireless network. And once you are connected to the internet, you can then go onto the OccluSense app and then carry out the initial setup. The system will actually prompt you to do whatever needs to be done so that you are taken through all necessary steps to get started. Once your setup is finished, you are able to then register your system. So your iPad then knows who you are.
Open your OccluSense iPad app, tap on menu item, settings, then choose handheld registration. Fill in the registration form. Please enter country, name, first name, street, zip code, city, and your email address. Tap the register button to send your registration data. A confirmation email will be sent to your email address. Open the email and press the confirm button. If your registration was successful, a green tick will be displayed.
And that's the registration of the system done. And once you have done all the formality,
to initiate the sensor test of the handheld has to be connected to the app first. Now go to Settings in the OccluSense iPad app. Having your handheld and the test sensor ready. Now tap on Functionality Test Handheld. You will now be asked to insert the test sensor correctly and to close the sensor flap. The pink-colored control button to start the function test. The function test starts now. The result of the function test is displayed in the app. Now, remove the test sensor from the handheld and put it back in the storage box.
okay, so you were nearly ready to get started. The sensor test is merely to show you how you are able to calibrate the system, and you don't have to do this before every use. The system will prompt you to do this automatically so that you can obtain highly accurate results each time. Right, so do we need OccluSense if we have a well-working system to check occlusion on our patients already? To understand the process, I would like you to take a look at this pathway. So in order to get from an initial contact over to the maximum intercuspal position, you have a process that is happening. So from one initial contact via sliding over pathway 2 into the maximum intercuspal position on 3, you are actually going through a process over time. So rather than looking at the occlusion over a process of time with papers and foils, you have the opportunity to check occlusion at the end of this pathway. So at point 3, which is the same as taking a picture of one single moment in time. With OccluSense, however, you have the opportunity to check occlusion over a period of time. So you have the ability to look at the initial contact, anything that's happening in between, and also see the final position. Therefore, with OccluSense, you have the opportunity to take a video over an amount of time. Do we really need that much in-depth information for our occlusal protocols? Well, if we take an implant as an example, we know that the tactile sensitivity of an implanted construction is about 8 times higher than those of vital teeth. Therefore, any too high construction or any changes within this environment are much more difficult to diagnose and can therefore lead to plenty of other issues, including craniomandibular dysfunction and any other dysfunctions of the occlusal system. There's plenty of other indications whereby OccluSense can be of help. You have the opportunity to look at hidden and interference contacts and look at early periodontal damage due to incorrect loading of individual teeth. You can take a look at the force distribution of the entire dental arch. This is, as we saw in the previous example, quite important for implant prosthetics, which then means that you can avoid chipping, and also look at the occlusion, the dynamic occlusion on splints, and compare these recordings over time. You have the opportunity to record orthodontic changes and any other occlusal movement, as well as use the protocol as documentation and for patient education. When you're using OccluSense, just like any other CRM system, you have a database with patients. So in this diagram, you can see that you have to press an add button, and you're then able to add the patient's details into the OccluSense system, fill in the blanks, and then you are able to activate the patient or look at older recordings. When your patient is activated, you can start new recording, adjust the time and the frequency of the recording, and then you can get started. If you have the handheld and use the green button before the recording, you can select the frequency or the live mode via the handheld as well. In this video, you can see how the sensor is inserted into the patient's mouth. Obtrugate is being used here to keep apart all the soft tissue in the surroundings. And then you can see how the static occlusion is then displayed onto the iPad. When you're pressing the pink start button on the handheld, the device is waiting for your first occlusal contact. So the first contact will then mean the recording can now start. Alternatively, if you are pressing the pink button again, you can manually start the recording. If you want more information on live and recording, you can take a look into the manual. We have quite some details and little tips and tricks summarized in there as well. As you saw in the OccluSense diagram, there's different colors and columns, and they tell you more about the pressure and the size of the contact points. So if you have low columns, you have low pressure, and if you have high columns, you have high pressure. Pretty straightforward. Regarding the colors, green colors represent a more area contact surface, whilst orange and yellow are something in between, and red are punctual contacts. To understand this concept that we've developed a little bit more, you can take a look at the load of this bridge that is being carried by the two pillars left and right. And what you can see here is that the amount of pressure that is being carried from each pillar is exactly the same. However, the contact surface to the ground from each pillar differ, which is why the height of the columns are the same, but the colors are different. So we have a wider surface on the left-hand side because the surface which is conducting the pressure to the floor is wider, whilst on the right-hand side, there's a punctual contact, which is why this is red. This is another example showing you a comparison with green, yellow, and also another red column to try and understand this concept a bit further. Right. How do we now take this information over into the clinical aspect of things? If you imagine you are standing on a plate covered with needles, and other than the pain that you are feeling on the sole of your feet, you can feel how every single needle is applying a different amount of pressure into your foot. And if we now take a little outtake of this needle plate and take a look at what does this mean and how are these pressure sensors being activated on our sensor, or let's call them pixels, then you can see that if we have two needles that are being compared to one another and the pressure change is quite large between them, we now know we have a punctual contact surface, which is why it's red. Orange and yellow are something in between, so you can see that the pressure change is not as big as the red ones, but it's bigger than the green one. And green is when we have an activation of the needles, which is very, very similar in the neighborhood, which is why we know we have a more area surface, and this is represented in green. Right, here we see interpretation of the red columns. The difference between the contacts is high. So we have high spots here and initial occlusal contacts, and also standalone contacts that are not in full intercuspidation. When we are interpreting the green columns, we have a difference between the contacts that is low. So this is the case for planar contacts, for example, on abrasive teeth, and areas of contacts with similar pressure. In general, it's very important to know that these colors are only a representation of what the contact surface to the ground, as you remember in the bridge example, is. So this is not a reason to be alerted. Red could be something very normal that you want to see within this area. It could also be a reason for you to adjust the occlusion. So it's dependent on your clinical interpretation of the data. And we should also always remember that the contacts are constantly being compared to one another. If we now take a look at this example for static occlusion, we can see that in the right molar region, we barely have any red contacts. So this does not mean that we don't have high pressure located here. In fact, if we look at the scalings of the percentages on this side and the quadrants for our pressure level in this area, we see that 23 and 21%, so 44% of the entire pressure are actually located right in this quadrant. So only because there's not many red spots, it doesn't mean there's not any high pressure. It just means that we don't have any standalone or punctual contacts that are carrying this pressure. And the same amount of information can be, oh, my finger was too fast, I'm sorry. The same amount of information can actually be conducted for dynamic movements, as you see in the visualization in just a moment. Here we go. Right. So we see first lateral occlusion to the left, followed by a lateral occlusion movement to the right-hand side. There we go. Okay. There's a couple of features of the OccluSense iPad app that I would like to also share with you. So we have viewing options that we can amend between 2-dimensional and 3-dimensional views. or you can go ahead, and that's actually my personal favorite, and look at a combined view. Okay, there's plenty of other additional controls that you are able to detect and use in your OccluSense app. So you have the possibility to go into full screen mode or use your finger to turn and twist the view. Also, you have the opportunity to pause, speed, and rewind, as well as do some noise cancelling. More options include percentiles and quartiles, as well as compare recordings over time. So apart from looking at nearly 300 different pressure levels, you can also reduce the amount of pressure levels that you're looking at so that you are filtering only the important information for you. If you want to export any data, you are able to do this by entering the full screen mode, and then the export button will appear, which then allows you to export your data onto your iPad. The same you are able to do for any video recordings. And the nice thing with the video recording is that if your vocal is enabled, your vocal control, then you're able to speak comments onto this video recording and then export the file, including your speech comments, into your camera roll. And then you can share this again by the export button. We also have a network access guide, which you can also download online if you want some more information on this. And to now clinically interpret these data sets that we receive, you need to ensure that the midline on your sensor is the midline of your patient's mouth. And the red triangle or the red line on the sensor that I've marked for you here with the black arrow needs to be inserted in your patient's mouth into the midline. And once this is the case, you are then able to directly transfer any notes and any points that you see onto your OccluSense reading. And the scalings on the side of the sensor can then detect and trace back every single color marking on the patient's teeth right back into the OccluSense reading. If you now look at this example, midline was also midline of the patient's mouth. You can see a regular occlusion on a molar in the blue circle, a regular occlusion on a premolar on the orange circle, and a premature contact. How do I know this? Well, if you look at the OccluSense reading, the two-dimensional view in the middle, you see that the quadrant is orange. This is already, for me, a big warning sign. Why is there more force being applied in this area compared to the other areas? So if I then take a look onto the clinical image on the left-hand side, I can see that I have a contact on the buccal surface of tooth 36, which has nothing to do there. So I now know this is a premature contact. This is the reason why I have such a high pressure load in this area, and fine adjustments can then lead to a more balanced occlusion. And the same can be done for any dynamic movements. So you see here the lateral protrusion to the right-hand side, quite some high pressure by group guidance. And a protrusional movement, which doesn't really lead over many front teeth. I've prepared a couple of clinical cases for you as well. Case number 1 is a patient who presented herself with ringing in the ear, the feeling of absorbent cotton, some cervical spine with ligament sheath prolapse. You can see in those clinical pictures that she already had quite a few restorations in place, and also complained about muscle tension in the face between nose and ear. Looking at an occlusion with OccluSense showed that we have a primary pre-contact on 48, an unequal load in intercuspal position, as well as final heavy loading from 41 to 45. Her protrusion showed parafunctionality on 48 again, and medial protrusion to the left, no canine guidance, but parafunctionality on 48. To the right-hand side, we had no group guidance, but parafunctionality on 48 and 38. Her bruxism movements were mainly over 43 and 48 again. And looking at her nocturnal movements, then showed us that in intercuspal, in a retral cuspal position, she had a parafunctionality on 48 again, and very slight fabrications of her occlusion actually led to her to bettering her symptoms she presented herself with at the beginning. The second case I've prepared for you today, we don't always have to use OccluSense for any pathology, sorry. We also have the opportunity to do simple dental checkups on our patients with OccluSense to ensure that the occlusion is balanced. And for this patient, you can see that there's contacts on the right surfaces, that her occlusion is quite balanced. Don't be thrown by missing values in the right on the right hand side. It's because antagonists in the fourth quadrant are missing, which is why there's no no pressure changes being detected. The same can be done for dynamic movement. So you can see here lateral protrusion to the left, including the markings of the teeth. As well as protrusion. And the final clinical case I've got for you today, OccluSense and splint therapy. I'd like you to take a look at the condylar processes of this patient. She's actually suffering from hemimandibular hyperplasia. And since she rejected any surgical intervention, we then decided to fit a night guard to protect the teeth and the mandibular joint. Her static occlusion without the night guard looked as follows. So I want you to take a look at the occlusal interferences as well as the force distribution. So I want you to take a look at the beginning. She actually has an open bite and then slides into further contacts as her bite advances. When fitting a night guard, we do a shim stock protocol. And when this shim stock protocol is everywhere roughly the same and positive, we then send the patients away and order them in for another checkup a week later or a couple of weeks later. We did the same for her, and she actually still had some issues with her joints, some pains when she was waking up and so on. And when we then checked her occlusion with the night guard fitted, we saw the following with OccluSense. If I pause this towards the end, this is what you would get when you're doing a shim stock protocol. And the shim stock protocol will give you a positive outcome nearly everywhere you would check. And with shim stock or with any manual occlusion protocol that you're using, the positive and the negatives or the plus and minuses are very subjective. So you are subjectively hard pulling out the occlusal foil, and you feel the resistance also subjectively. So this is actually quite a process which cannot be really standardized. And here you can see that this patient has a open bite on the left-hand side. And with OccluSense, checking this bite, we see that at the beginning of the occlusion, this is actually not really balanced. So this information is missing when we're doing a shim protocol. Okay. Occlusal movements in the dynamic direction can also give you the same information. So her canine guidance is not very balanced either. And the same with the protrusion. So we actually gain quite some more information than we would have using shim stock or a normal occlusion foil. And I'm not saying that you're not able to detect these kinds of informations with papers and foils, but they're very much harder to detect. So it takes much longer to, and it's also harder to instruct the patient to conduct those movements. The most important question for today, does OccluSense replace articulating paper or foil? I'd say it depends on the indication. So if you need a picture of a moment in time, you can use papers and foils. You get a quick snapshot of a single moment in time. If you need a video recording for much more in-depth detail, then you can use OccluSense. The algorithm that I personally use is using OccluSense before and after. So you check for premature contact and the pressure distribution with OccluSense before, adjust the occlusion with papers, and then use OccluSense again to ensure that your results are still good. What you're also automatically doing is you're documenting the data. There are plenty of other professionals within different countries with different specialities that have used OccluSense and benefited from the digital benefits, from faster occlusal control, either in conservative dentistry, implant prosthetics, in prosthodontics. So there's plenty of indications whereby OccluSense can be of good dental practice, as well as CMD, very popular in the past few years. And if you want to get started with OccluSense, what you need is an Apple iPad, produced versions 2014 and later. It's the iPad app, which can be free to download on the Apple Store. You can select different languages. You need a Wi-Fi connection and the OccluSense system BK5000. Thank you very much for your attention. Let me have a look in the chat for questions. Okay, so how much millimeters is splint in this case? I can't tell you actually because she has an opened bite, so the material is differently sized in different areas. It really depends which area you're looking for. And in the example with the Brux checker, it was nocturnal movements that were recorded. So it was a night Brux checker. RP going into ICP tight, you'd have to explain a little bit more. I'm not sure what you mean. And how much pressure a normal occlusion should have. Yeah, you'd need to specify this as well. What do you mean by normal occlusion? Do you mean the textbook occlusion? Because OccluSense is quite a relative process of occlusion control. So it will give you a relative amount of pressure that is being applied, but it will not give you a specific value for the pressure.
Hello, thank you very much. I think I will talk quickly because otherwise writing will take a little bit time. Um, the first question was how much pressure normally occlusion should have. So because you have the distribution of the whole arch, and I would like to know what is then Bausch telling, okay, how much pressure is okay for the tooth or how much is already too much if we see such high loads on some teeth in some cases.
You mean how much pressure the tool can withstand?
Yes, exactly. And then when we have then to intervene to say, okay, this tooth have now too much pressure, so we have to, I don't know, we have then to raise our teeth to get some more contact, so the other tooth is getting not so much high pressure
Mhm.
anymore
I
in
well,
some
I can't give you a numeric value for how much, but I can tell you that I personally aim for a balanced occlusion. So I'm looking for an evened out percentage check all around. Does
Okay,
that answer your
thank you.
question?
Yes, yes, this answers my question. And the other question with the RP is like, because you showed the first contact to maximum intercostation. So my question is still, we start in reference position and then go from
Mhm.
reference position to maximum to ICP, maximum intercostation. Is it correct?
Yes, it is. It is. So we're starting from the oh, I'm looking for the word in English. It's not actually the retral position, so it is mm, the resting position, if I understood correctly, and then go into maximal intercuspal position for static occlusion.
Okay, understand. Thank you very much.
Mm-hmm. And the other two questions, yeah. So Knight Brux checker is the one that we used, and the other one with the millimeters of the splint. Yeah,
Yeah,
because
I can only say about the Brux checker because the OccluSense, I understand the bruxing behavior, but we still have
Mhm.
to tell here the Brux checker is showing us the unconsciousness bruxing and the OccluSense showing the bruxing, how the patient is doing it in the chair. So
Absolutely,
there's also
yes.
a
So
little bit of difference, yeah. So that have to be maybe also
exactly.
highlighted here. Yeah.
Mhm. Yes, definitely. Yeah, and again here just to show the splint, so it's we usually raise in the articulator, well the lab raises in the articulator about 4 millimeters, and then they start fabricating the splint until they get a evened out occlusion. And obviously this also differentiates when you are trying to fabricate a front plateau and trying to get the dynamic occlusion over canine movement. So everywhere the millimeters is different.
Yeah, I understand this is the Michigan splint type. I know that. And
Mhm.
I know this 4 millimeters. Normally in our curricula and our education, we're raising the pin only indication of the ceph. So we're measuring the ceph,
Mhm.
lateral ceph, and say like how much millimeter we have to raise
Okay.
if we can raise. That's why I wanted to just that.
Oh,
And also here in the OccluSense, what I'm quite astonished is that normally in the splint we should have immediately a balanced contact. So also the OccluSense can show here actually the how close we are in all tooth contacts during the maximum intercostation. Is this also correct?
yes, absolutely.
Okay,
Definitely correct.
understand.
Mhm.
Thank you very much.
You're very welcome. Do you have any other questions? I think
For me, no, because
yeah.
I'm the only one here today.
Yeah.
uh, yeah, and my voice is not really well. I'm sick a little bit, so that's why I have also time for that. No, I have no other questions. Thank you. We have it actually itself in the office, OccluSense, but we're not using it that much. So I wanted maybe new inspiration to how we can use it also for studies or for
Definitely try
patients.
it again, especially for CMD cases. It's been very, very helpful. Okay, I'm gonna put in the last slide again. If you do have any cases that you would like to discuss or any questions you have further down the line, feel free to drop me an email. Other than that, if there's nothing else open today, then I would like to thank you for your time today, and also wish you that you get well soon. A lot of
Yeah,
people
it's
are
my
sick.
4th day already being sick, so the normal
Yeah.
flu. So it's everything fine, I would say.
Okay. All right then. If the last page wants to come. Here we have, okay.
I think that the Bausch family knows the Slavacek family as well. So my
Okay,
second name
perfect.
is quite known in the dental industry. So I know them as well. So it's quite fun.
Yeah. Okay, perfect. Right. So then thank you very much for your time today.
Thank you.
Get well
Ciao,
soon
ciao.
and have a nice weekend. Bye.